Cirrhosis. That's the medical term for scarring in the liver. Cirrhosis can impact many parts of your life, but having the right knowledge and support can make living with it easier. Before we talk about cirrhosis, let's go over some things about the liver. The liver is one of the largest and most important organs in your body. It's like a factory that does hundreds of jobs. Medicine and all the things you eat and drink travel from your stomach to your gut and then into your blood. Your blood gets to the liver through a large blood vessel called the portal vein. In a soft, healthy liver, blood flows in easily, like water from a hose pouring into a sponge. Now, the factory work begins. Your liver takes things to store for your body, like sugar and vitamins. It also takes out things, like toxins and bacteria. It breaks down medicine so your body can use it. It makes proteins that help your blood clot. And it makes bile that drains out of your liver through small tubes called bile ducts. Bile travels to your gut, where it helps you digest food. Many things can damage the liver. Alcohol is a major one. Having too much fat in the liver can damage it too. This happens to people who are overweight or have conditions like diabetes or high cholesterol. Viruses like hepatitis B and C can also cause damage. There are genetic diseases passed on through families and other diseases that make your immune system attack your liver or bile ducts. Whatever the source, damage to the liver can cause scar tissue. Over time, this shrinks and hardens the liver. This is called cirrhosis. If you've been diagnosed with cirrhosis, you'll be wondering what to expect. Cirrhosis has 2 stages. For most people, it gets worse over time. But treating the cause, like quitting alcohol or getting rid of hepatitis C, can help a lot. The early stage is called compensated cirrhosis. In this stage, some people have symptoms like low energy or feel really tired. Others have no symptoms at all. In fact, it's really common to have compensated cirrhosis for years and not know it. Remember, in a healthy liver, blood flows in, like water from a hose into a sponge. Now imagine the sponge is hard like a rock. Water can't flow in easily, and pressure builds in the hose. Just like with the hose and the rock, pressure in the portal vein builds when the liver gets scarred and hard. This is called portal hypertension. Pressure buildup can spread to nearby blood vessels and make your spleen bigger. When you have a big spleen, it can take longer to stop bleeding, and you can bruise easier. These symptoms are also part of the compensated stage. If the pressure builds too high and the liver can't do all its factory jobs, you can have major complications. This includes fluid buildup in your abdomen or belly called ascites, or bleeding from swollen veins in your esophagus, your food pipe, called variceal bleeding. Forgetfulness and confusion can be another complication. This is called hepatic encephalopathy. If you get any of these complications, the stage is now called decompensated cirrhosis. At this stage, you'll need to work more closely with your healthcare team. Depending on your age and other medical conditions, they may even suggest a liver transplant. No matter what stage your cirrhosis is at, having the right knowledge and support can help.
Ascites. That's the medical term for fluid buildup in the abdomen, your belly. This can happen to people with scarring in the liver called cirrhosis. For some people, the fluid can move up to the space around the lungs. That's called pleural effusion. If you have fluid buildup, your healthcare team will ask you to lower the amount of salt or sodium in your diet. You should take in less than 2,000 milligrams each day. This will help lessen your fluid buildup. Your team might also prescribe water pills called diuretics to help you get rid of extra fluid when you pee. Diuretics can have side effects, so you'll need to get regular blood tests and keep track of your weight. This will help your team see how you're doing and decide if you need to adjust your diuretics. Let them know if you're dizzy, not peeing much, or losing weight quickly. If you have a lot of fluid buildup, you might need it drained with a needle. For ascites, or fluid in the belly, this procedure is called a paracentesis, and for fluid around the lungs, it's called a thoracentesis. You might need the fluid drained just once, or you might need it done every week or two. Sometimes bacteria can grow in the fluid, causing a dangerous infection. Watch for a fever, sharp pain in your belly or chest, feeling sick to your stomach, or throwing up. If you have any of these symptoms, call your doctor or nurse right away or go to the emergency department.
Paracentesis is a procedure that uses a needle to drain fluid from the abdomen or belly. This fluid buildup, called ascites, can be caused by many different conditions. In this video, we'll talk about having a paracentesis to drain ascites caused by cirrhosis. If you have ascites, you may have pain, feel short of breath, or have trouble eating because your belly feels full. If you have these symptoms, your healthcare team might suggest a paracentesis to remove a large amount of the fluid from your belly, or they may want to collect a fluid sample for testing. Paracentesis usually happens at a hospital. Before your procedure, the doctor or nurse practitioner will check your belly for a good spot to insert the needle. They'll do this by tapping on your belly or by ultrasound, where sound waves are used to show a picture of the fluid. When they've chosen the best spot, they might use a needle to put freezing medicine under your skin. This will numb the area and should make you more comfortable, but you may still feel a very brief, sharp pain during the procedure. Next, they'll insert a needle to drain the fluid. If there's a lot of fluid, they'll drain it into containers connected to the needle by a small tube. They might ask you to change position to help drain the fluid more easily. When your fluid has finished draining, the team will remove the needle and bandage the spot. If you had a lot of fluid, your doctor or nurse practitioner might prescribe a protein called albumin. You take albumin through an intravenous or IV, which is a small tube or needle put in a vein. It lowers your risk of problems from the drainage. They might also send your fluid to the lab to make sure you don't have an infection. You'll likely be at the hospital anywhere from 2 hours to a full day. It depends on how much fluid you have drained and how much albumin you need. If your fluid comes back showing you have an infection, you'll probably be admitted to the hospital for treatment. This is not common, but it can happen. After the procedure, keep your bandage on for 24 hours. Then you can remove it and have a shower. You can wash the needle site gently with soap and warm water. You might feel sore for a few days, but you can go back to your normal activities unless your nurse or doctor gives you other instructions. Just like any medical procedure, paracentesis has risks you should know about. In rare cases, infection, bleeding, or a tear in the lining of the intestine can happen. If you get belly pain, fever, bleeding, or fluid is leaking from the needle site, call your doctor or nurse, or go to the emergency department right away. If you have ascites, it's very important to eat less salt. This helps slow down the fluid buildup in your belly and give you more time until your next paracentesis. Some people need a paracentesis only once. Others need one every week or two. Your healthcare team will work with you to decide how often is best for you.
Hepatic encephalopathy. That's the medical term for a buildup of toxins that affect the way your brain works. This happens when there's scarring in the liver, called cirrhosis. When you have encephalopathy, the buildup toxins can cause confusion and other symptoms. If it's not treated, it can even cause a coma. Let's look at where body toxins come from. We all have bacteria in our bodies. They help your body work properly, but they also make toxins that the liver removes. If you have cirrhosis, your liver has a hard time getting rid of those toxins, and you can develop hepatic encephalopathy. As well as confusion, toxin buildup can cause you to forget things and change your sleep pattern. So you might feel sleepy during the day and wide awake at night. It can affect your mood, so you might get upset or bothered more easily. It can also give you the shakes or cause you to have problems with balance. Encephalopathy can affect how quickly you react, so your healthcare team might tell you not to drive. Your healthcare team will usually prescribe lactulose if you have encephalopathy. This special laxative makes you have more bowel movements to help your body get rid of toxins. You'll need to keep track of your bowel movements and take enough lactulose so you have 2 or 3 soft ones each day. Take this medicine until your healthcare team tells you to stop. Rifaximin is another medicine that can help you manage encephalopathy. It changes your gut bacteria so they make fewer toxins. Some things can make encephalopathy worse, like infections, not having enough fluid, called dehydration, and bleeding. Some medicines can also make it worse, like painkillers and sleeping pills. Share what you learn about encephalopathy with your family and friends. They can help you watch for symptoms. If they notice you're not thinking clearly or are sleeping more than usual, they should contact your doctor or nurse right away. But they should call 911 and get you to the emergency department if they are having trouble waking you up or notice you can't talk, walk, or follow directions.
Hello, we're here today to talk about eating well with cirrhosis. Did you know that nutrition plays an important role in managing your cirrhosis? Nutrition is important because your liver might be working harder than usual and you may not be able to store as many nutrients as usual when you have cirrhosis. People with cirrhosis require more protein and calories than the average person. Let's go through 4 tips you need to know about fueling your body when you have cirrhosis. First tip, eat regularly. Eat every 3 to 4 hours when you're awake. This means eating 3 meals and 2 to 3 snacks a day, including a bedtime snack. Eating regularly helps to ensure your body has the energy it needs. Getting enough energy and nutrition can help you stay strong and supply you with the energy you need to do your daily tasks and routine. Second tip, eat enough protein. Talk to your healthcare provider about how much protein you need. Protein helps to keep your muscles strong and your immune system healthy. Protein can be challenging to get enough of if you're not feeling well. However, it is important that you eat enough protein at every meal and snack to make sure you're getting enough. See the Eating Well with Cirrhosis handout for a full list of protein foods, or you can read the nutrition facts tables found on food labels to learn how much protein a particular food has. If you want to learn more about protein, check out our videos that discuss protein. Third tip, let's talk about sodium. Sodium is found largely in salts and processed foods, though small amounts of sodium is naturally found in most our foods. When you have cirrhosis, eating a lot of salt or foods high in salt or sodium can cause you to retain fluid in your belly, legs, and even lungs. This extra fluid can make you feel full quicker, and it can make it difficult to get enough nutrition. In addition to limiting high sodium foods, you can also reduce the sodium in your diet by not adding salt to foods while cooking or at the dinner table. To get a flavor boost, Add herbs like dill, oregano, and chili powder. Use salt-free seasoning blends, lemons and limes, vinegars, or garlic and onions. Over time, your taste buds will adjust. Check out our videos on label reading and low-sodium cooking to learn more. Fourth tip. When you have cirrhosis, you are at higher risk to develop osteoporosis or weak bones through bone loss. It is important to eat and drink enough calcium and vitamin D to prevent bone loss. You can increase the calcium and vitamin D in your diet by having 3 to 4 servings of dairy or dairy alternates each day. You will notice that many calcium-rich foods are also high in protein, so including them can benefit you in many ways. If you are not able to meet your calcium and vitamin D needs with diet, your healthcare team might suggest a supplement. Be sure to talk to them about which one is right for you.